When the weather is dreary, as it has been for much of the winter, many of us will experience the blues. We complain, but we don't feel the depths of pain those with true clinical depression experience. Ray Yoder, a 65-year-old Elkhart business owner, and Shayna Breslin, a 41-year-old South Bend nurse, know the pain all too well.
Like I said, is life worth living? Not really. You know, it's tough. It's really tough.
I would say that I very first noticed kind of a flagging sensation in my will to live when I was about 14.
Ray also believes he was depressed in his teens, but managed to function until the early 2000s. He says he was never suicidal, but
it's a form of pain to me. But mostly I felt bad about myself, and I can see that if that would go on for weeks or months, yeah, I understand why people would commit suicide. I've gotten close already.
Like Ray, Shayna says she would work, but on her days off and on weekends, she couldn't get out of bed.
I just had no energy for anything. I'd make plans, but I'd always pull out of them. I just couldn't get myself up and at them at all. I was just downhearted, like very downhearted, and that was when I'm like, oh no, you know, this isn't good. Yet I get sort of a faded tunnel vision when I'm depressed. Everything, the color kind of leaches out.
For people who don't suffer from depression or know someone who does, you may be thinking, why do they feel this way? Buck up, look at all you have to be grateful for. But Dr. Elmaadawi says just like cancer and diabetes, depression is a disease.
They sometimes feel hopeless or worthless, and that feeling manipulate and hijack the entire brain to the extent that you really don't care anymore and you want to die. And that's when they decide to end their life.
Even though Ray and Shayna were depressed as teens, neither tried medication until they were adults. Shayna says it's exactly the mindset that many have that kept her from getting to a doctor and taking medication.
You know, the fault is in you. If you just pulled yourself up by your bootstraps, you'd be fine, but that's just not true.
Ray got so low, he finally decided he needed help.
And so I went to a psychiatrist, and they started prescribing drugs, and, you know, Prozac worked for a year, which was nice, and but then it quit.
Ray spent $10,000 over the next 5 years trying one antidepressant after another.
I don't think they had any effect at all.
Shayna took meds too and also exercised by biking and kayaking, but
I was losing hope that the meds were going to help me.
It is that helplessness and hopelessness that led both Ray and Shayna to Memorial Hospital psychiatrist Dr. Ahmed Elmaadawi, who was using ketamine, a drug surgeons use as an anesthetic, and a drug known on the street as Special K, to treat severe, unrelentless depression through infusions in his office. Unlike antidepressants, which take weeks to kick in,
the response within 24 to 48 hours, most of the patient will have 50% decrease of their symptoms. So the ketamine, the idea of the fast acting, it's one of the interesting interesting most of the providers to use in acute situation. We found actually ketamine has decreased the suicidality of those patients within 24 hours.
Ketamine works differently than traditional antidepressants, not only with the speed in which it works, but on the pathology of depression. Experts suspect there may be an inflammatory component to depression, and ketamine may zero in on that.
And what makes us excited about it is it's really interesting to regenerate neurons, not just chemical imbalance.
And it's done with 7 infusions inside Dr. Elmaadawi's office as an outpatient procedure.
And we actually use it through a slow infusion over 45 minutes through the IV line.
A possible lifeline for many who suffer from severe depression, and one that both Ray and Shayna are ready to try.
I'm trying everything that I think might work.
Whatever I need to do, I want my life back.
We have to make sure that it's the right patient.
Right.
Some patients really not having just depression.
Dr. Ahmed Elmaadawi of Memorial Hospital is talking about those who would qualify to try ketamine, a drug many researchers believe could lead to the future of treating severe depression. It is by no means a miracle drug or cure, but Dr. Elmaadawi says it saves lives.
While they are going through the acute crisis, while they are actually going through severe depression, when patient is depressed, they lose hope. And I believe ketamine gave them that hope.
Patients like Ray Yoder and Shayna Breslin, both of whom suffered from depression from their teens, but didn't try medication and therapy until their adult years.
Basically, I just felt bad.
Less energy, more sleeping, less desire to get up and go, to be part of life.
Ray and Shayna aren't alone. Every year, roughly 14 million Americans suffer from major depression, and 3 out of 10 will not get better using traditional antidepressants. For them, psychiatrists are going off-label and treating patients with ketamine, a drug used for anesthesia and as an illicit party drug. But recent studies indicate impressive benefits for those suffering from major depression.
We found actually ketamine has decreased the suicidality of those patients within 24 hours.
They also know it works differently and with almost immediate relief than traditional antidepressants.
The idea of ketamine, it actually works totally different on generating neurons. There is a new theories about depression as almost an inflammatory reaction.
Patients like Shayna come to Dr. Elmaadawi's office for outpatient infusions.
So usually it is 7 treatments. It is 3 treatments per week, Monday, Wednesday, Friday. And we usually, by the 7th treatment, patient achieve the full recovery.
It is not a magic bullet, and Dr. Elmaadawi stresses it is not a long-term fix.
But we know that 70% of patients who achieve recovery from ketamine will have relapse symptoms within 2 weeks.
Again, getting patients through an acute crisis as they continue to work with their psychiatrist and stay on medications. Because ketamine is being used off-label, insurance doesn't cover the infusions, so Ray and Shayna paid the $550 per infusion out of their own pockets. Dr. Elmaadawi says one of his patients who achieved remission is able to come in once a month for a booster and remains in remission. But for those who will not achieve full remission,
and over the course of the treatment and infusions, I try to follow their symptoms. Once we achieve remission, after hopefully 7 infusions, and usually we see it within 3 to 4 infusions, we try to taper down how frequent they will need it in the future.
Ray explains how the infusion feels.
It made everything unreal, but it wasn't unpleasant. It was just different and strange.
Did it take your mind off your depression?
Oh, sure. I was so far removed from my normal state of being, I had no depression.
The goal is that after several treatments, a patient will be less depressed. But for Ray?
And that didn't happen for me, unfortunately. Maybe a little bit, but not enough.
He had a short period of relief. He actually had severe depression, has a chronic severe depression.
And because Ray was not getting the relief that was hoped for, his infusions were stopped early. What about Shayna?
I'm an avid bicyclist. I like to kayak. None of it seemed to hold any interest or promise.
Shayna says she went into the treatment with no expectations and?
But the second treatment, started waking up in the morning. That's when I can usually tell. I'll wake up in the morning and literally, like, sounds are sharper, the colors of things are more saturated. I get sort of a faded tunnel vision when I'm depressed. And then I had been really stalled out a bit in my career. Then I applied that day for like 7 jobs, and I had an interview today.
And getting back in the exercise routine, she started going to yoga class again. She's also looking forward to springtime and riding her bike.
I feel in possession of all my facilities during treatment.
And she told Dr. Elmaadawi during her 4th infusion,
Depression's such a weird feeling. It's kind of like having your heart broken, but you know that nobody broke it, but you feel like they did, you know?
while not a long-term fix, Dr. Elmaadawi feels ketamine will continue to show great promise.
Definitely it's a start to understand how could we treat depression in a time fashion, especially during crisis episode.
With patients continuing therapy and medication. Even though Ray did not receive the relief he hoped, he is still a big advocate of ketamine.
I'm glad I tried it.
Would you suggest other people who are depressed?
Oh, absolutely, yeah. And there's nothing to lose. It can't hurt you.
And with 3 infusions yet to go, Shayna is feeling hopeful again.
If this is where I'm going to be now, which I'm feeling a lot better, I can live with this and live the life that I know is is the real me, you know, the real version of me that is engaged with the world and has a lot to give.
And while studies for long-term treatment are underway, Dr. Elmaadawi has no doubt about the progress made so far.
Few patients, I know them personally, who are almost on the edge of ending their lives because of their illness. Ketamine saved their life.